Hi everybody, John Herzenberg here, and we are going to talk about how to correct a club foot with a hexapod fixator. The model that you see here is a model that was designed and built by Dr. Ponseti to demonstrate how to do the Ponseti sequence of first abducting the forefoot, and then you do a tenotomy of the Achilles and get rid of the equinus. So we're going to try to reproduce that sequence, what I call the Ponseti sequence, with an external fixator. And why would this be helpful? On a recurrent clubfoot, on an older child, someone in whom the traditional casting and tenotomy may not suffice. So let's just take a minute to look at the deformities. Here's the tibia and fibula. The foot is internally rotated through the subtalar joint. If I turn it around, and you look at the back of the calcaneus, it's in Varus, and it's also plastered up against the fibula because it's internally rotated. So one of our goals is going to be to rotate it externally, rotate the whole foot externally, and move the back of the calcaneus away from the fibula. From the AP view, there's some adductus. And normally I try to cast some of that out so we don't have to worry about that with the frame. But the entire foot needs to be rotated. So we will leave the talus here, and our thumb, or in the case of the frame, an olive wire will be up against the lateral side of the talus, and the foot will rotate underneath it. And this is the Ponseti sequence of gradual abduction. And then once we get to that point, we'll simulate the Ponseti tenotomy by taking the entire foot and dorsiflexing it. So we'll end up using a ring. It fits nicely here. You could also use a foot ring that's open in the front, but for this model purpose, this 180 millimeter ring fits nicely. So I'll put this ring on, and then we'll put a smaller ring on the tibia to mimic the tibia. Now this is a short model of a tibia, and so I'm going to have to be a little bit creative as to how I mount this ring on the tibia. This is the foot ring that I've placed, and once again I used a ring because it fits nicely on this foot, although you notice this foot doesn't have toes on it, so if I had a real foot I might want to use a ring that would be open for the toes. We could build something out, but for purposes of this demonstration, I've used a full ring. And the fixation is surprisingly simple. I'm going to flip it over so we can look at the bottom. I've got two counteropposed olive wires in the calcaneus and a smooth wire that goes through the metatarsal number 5 to metatarsal number 1. And that's one of the principles of putting this wire in as you go from a small target to a big target. So we start on 5, aim for 1. And these are counteropposed so the foot doesn't slide. And the other wire you'll notice here is the talar neck wire. And this is our Ponseti finger that's going to be blocking the talus while the foot moves around it. That's how Ponseti put his finger. In fact, inscribed here there's a little TH for thumb. So that's going to be the first maneuver, rotating through the subtalar joint underneath the talus. And this will be attached to the tibial ring to start, and then when we do the equinus, we'll attach it to the foot ring. Next, I'm going to put on the tibial ring. Now we've added the tibial fixation. So we have a simple ring on the foot and a simple ring on the tibia. This could also be a 2/3 ring. Next, what I'll do is I'll add the struts that connect the tibial ring to the foot ring. And we'll also add some special step-off plates or paddle plates suspended from the tibial ring so that this wire, it becomes associated with the tibial frame, not the foot frame. At this point, I've attached the 6 struts for the hexapod, labeled 1, 2, 3, 4, 5, and 6 counterclockwise. And the only thing left now is to attach a paddle plate to the proximal ring so that I can capture this talar neck wire. The talar neck wire is what keeps the talus together with the tibia, and then the foot will rotate underneath that in the subtalar joint. So we'll add one paddle plate here, we'll add another paddle plate here, and that will complete our frame. I've also added two markers at the equator line of this ring. We can add a third one at the front to back equator. The computer is going to want to know where is the center of the ring. So when we take a reference shot, we can overlap these on the reference shot with a mag marker. This is the completed hexapod frame that will recreate the Ponseti sequence for correction of this residual or recurrent club foot. A simple tibial ring, a simple foot ring, 3 wires in the foot plus a talar neck wire that represents Ponseti's thumb against the neck of the talus. And since that thumb is also on a hand that's holding the tibia, that wire is connected to the tibial ring. The foot will rotate underneath this. With the patella pointing forward, the foot is internally rotated. I'll first program this to rotate externally. That wire is attached with these two special paddle plates to the tibial ring. Once I complete the derotation, the next step in the Ponseti sequence is to correct the equinus. So when we correct the equinus, we want the correction to occur in the ankle joint, whereas the derotation we want to occur in the subtalar joint. By having a wire in the neck of the talus and having that wire attached to the tibial ring, we're focusing the correction around the subtalar joint. Once we complete that rotational correction and we go to the equinus correction and we reprogram the frame to correct equinus, then at that point we'll detach this talar neck wire from the tibial ring and attach it to the foot ring so that the talus moves together with the rest of the foot. That is why I deliberately left these two wires curled long, whereas all the other wires have been cut short. Because I need, in another 2 weeks or so, when we come back to do the equinus correction, I need to uncurl these, attach them to the tibial ring with posts, and then retension them and remove this. So if I take a post and attach it with a plate to the foot ring, and then detach it from the tibial ring, this wire in the neck of the talus will change tasks. Instead of focusing the force on the subtalar joint, it'll be turned down and focus the force on the ankle joint. At this point, we've completed the application of this Ponseti sequence hexapod frame to this residual or recurrent clubfoot. And now I've taken the x-rays of the frame and we'll look at some of the parameters and look at some of the inputs that we have to use for the program. So first of all, when I took this x-ray, I took it so that the x-ray beam was parallel to the reference ring. The reference ring is the yellow line, and there's also some reference markers marking the center of the ring. For example, this bolt right here represents the center of the ring. And just to reiterate the reference line of the foot, this is a line that's perpendicular to the plantar surface of the foot, and it passes through the lateral process of the talus. So that's the universal reference line for a normal foot. And the reference line for the proximal segment, the moving segment here, is the blue line. That's a mid-tibial diaphyseal line, a mid-diaphyseal line in the tibia. And that intersects the red line, or the reference line, at a certain point that we're going to determine and call that the apex of the deformity. And here it measures 22 degrees. So we have a 22-degree equinus that we have to deal with. Also, I've shown you on this image, there's a magnification marker. This could be a steel ball, or in this case, I used a steel cube that I happen to know measures 53 millimeters in length. So we can calibrate our x-rays that way. Now let's look at the AP view of the ankle. This is more of a clinical measurement, but I've gone through the motions of drawing the lines. What I'm trying to show here is the amount of varus in the hindfoot. So I'm estimating this to be 10 degrees. The red line represents a perpendicular through the reference ring or through the plantar surface of the foot and the mid portion of the talus. The blue line is the moving line, and that represents the mid-diaphyseal line of the tibia. So the intersection between these two lines is the apex of the deformity, and the angle here measures 10 degrees. And we have the option of going more than 10 degrees if we want to get some overcorrection. Now, what about the mounting parameters? Because the computer's going to want to know where we put this frame on relative to the foot. So the yellow line represents the frame. Within this, this long bolt represents the mid portion of frame, the equator line. The other long bolt here, front and back, represents the midline on the AP view. But on the sagittal view, this is the midline. So going back to our reference lines, the red line is the perpendicular to the plantar surface of the foot that passes through the lateral process of the talus. The blue is the mid-diaphyseal line. The intersection is the apex, and in this planning mode, we'll call the apex the corresponding point. Now we just need to determine an origin. The origin, by definition, is always on the reference line. And so we'll go up about 1 centimeter because we want to do 1 centimeter of distraction, and designate this point here about 1 centimeter above the corresponding point as the origin. And what you can think of conceptually is that the red dot, the corresponding point, is going to move up the reference line to the yellow dot and then angulate by the amount of angulation that we have here. So the computer wants to know, where did you put this ring relative to the reference line or to the origin? And the orange double arrow here is showing you the distance from the middle of the ring to the reference line, here 31 millimeters. And the green double arrow line is showing you the distance from the middle of the ring to the origin, to the yellow dot, and here it measures 38 millimeters. So that's our origin, and the distance from the origin to the reference ring is 38 millimeters. So that's it. That's all we need to know in terms of mounting parameters. So let's go to the next image. This is an AP view, and I did put the ring on pretty much centered on the ankle, but at least on my x-ray, if I draw this green line that represents these long bolts, that is the center of the ring, superimposed front and back, we're about 4 millimeters medial to the reference line. So that doesn't make too much difference, but we'll put that in the parameters all the same. So our AP mounting parameters is 4 millimeters medial to the origin. So our first correction in the Ponseti sequence is to correct the varus and the internal rotation. The second part will be to correct the equinus. So let's go to the computer program, and we're only going to program in varus and internal rotation. We're going to leave the equinus for later. So here's our first of 7 panels that we have to deal with. First one asks for case information. This is the name of the patient, the date of the surgery. You have a chance to put some notes in here. So I said we have 22 degrees of equinus, 10 degrees of varus, and this is a clinical measurement, 30 degrees of internal tibial torsion. And we say this is an ankle, long bone frame, and total residual covers 99% of the frames that we do. Chronic is only used for pre-construction of frames. So, and I clicked off the fact that we're operating on the right foot here. The next panel is the input of the deformity parameters. First question wants to know, are we using a proximal or distal reference? And in most foot cases, we use a distal reference. In this case, it's the reference ring on the plantar surface of the foot, or parallel to the plantar surface of the foot. And the deformity parameters that we put in are the 10 degrees of varus, 30 degrees of internal rotation, and we're also going to program in 8 millimeters of shortening. In other words, we want to lengthen this, so we're describing the deformity as short, which means we're going to lengthen or distract by 8 millimeters. This will help to disengage the articular surfaces. And the 30 degrees of internal rotation is a combination of the current 15 degrees of ITT plus an additional 15 degrees that we want to correct, so it'll be 30 altogether. You notice that we have not put in the equinus. If we're following the Ponseti sequence, equinus comes later. If we first work on rotation and varus, and then we go back and cut the Achilles tendon in the Ponseti sequence, in this case, we'll use the frame to lengthen the tendon. Now we'll move on to the frame parameters. I've selected here that we used a full ring, 130 millimeters on the tibia, and a full ring, 180 millimeters on the foot. And these are the various struts that we use for this frame, 3 longs, 2 shorts, and another long here. So that's very straightforward. Now we'll go on to the next panel, which is the mounting parameters. And we measured these from our x-rays. We said that on the AP view, the center of our ring was medial to the origin or to the reference line by 4 millimeters. It was anterior to the origin by 31 millimeters, and it was distal to the origin. You know, the origin is up here somewhere, so it's distal to the origin by 38 millimeters. We don't have any rotary frame angle. The frame was mounted in a rotationally correct mode. So now we can move on to the strut settings. And here's where we input the lengths of the various struts that we have. So this is the number 1 through 6. I input these and then I hit this button and the computer will chug along a bit and then come up with the final results. And these represent the initial strut settings, the final strut settings, and I'm showing you what the frame is going to look like. Now notice that our frame looks like this because the frame mimics the Aquinas, but we didn't tell the computer program that we had Aquinas. We only told it we have Varus and internal rotation, and it's a little bit short. So the computer is drawing the bone as if there's no Aquinas. So we're just kind of fooling the computer because we want to do this in a sequential manner. So don't be alarmed that the tibia looks straight up and down. It doesn't seem to be fitting in our frame. We haven't yet told the computer that we have Aquinas. Let's go to the next frame, which is the structure at risk. And here, the structure at risk will be the Achilles tendon. I suppose that would be a reasonable thing. This is all soft tissue correction. And since we are going from varus to valgus, the soft tissues on the medial side would be at risk. So they're going to be moving the fastest. So we'll just choose something about 15 millimeters medial to the midline of the foot and 45 millimeters posterior to the reference line to represent the Achilles tendon. As far as the rate of correction, we typically go a millimeter a day. But in this case, because I'd like to show you a shortened schedule, I'm going to go at a rate of 3 millimeters per day, and this will complete the schedule in 10 days. And here's the final panel, which is the prescription that we give to the patient. Day 0 is where they start. You'll notice that we do have to change one strut here from a short to a medium, strut number 5, and these are the final strut settings. So what I'd like to do now is take this page and go back to the lab and adjust the frame that we just built and change one of the struts there, number 5, and let's see what our frame looks like. So I sat down at the computer and I programmed in the correction, or actually a partial correction. I programmed in 10 degrees of varus correction. I programmed in 30 degrees of derotation. Because we were 15 degrees internally rotated, I made it 15 degrees externally rotated. What I did not program in is the Aquinas correction. So we're trying to recreate the Ponseti sequence. So we're still in Aquinas, and that's next. And if you were doing a Ponseti sequence, you would externally rotate the foot, abduct, 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 and then when you reach a certain point, the heel's in valgus, your foot is externally rotated sufficiently, then you cut the Achilles. So we're at that point now where we would, in a Ponseti sequence in an infant, cut the Achilles. How does that translate to what we do in this model? Well, in this model, we're going to now program in 22 degrees of Aquinas correction, because that's how much this measures. And we may do a second program after that to get it to overcorrect into dorsiflexion. But before we do that, I'm going to modify the frame because up till now the rotation has occurred in the subtalar joint. You can see some distraction in the subtalar joint here. And now the rest of the correction is going to occur in the ankle joint. So I'm going to take this wire and unfurl it, attach it to the foot ring, and then we will program it up, and that will focus the forces on the ankle joint instead of the subtalar joint. Well, we've done the first correction. You've seen that we corrected the rotation and the varus, and we distracted the frame a bit so we have some space in the subtalar joint. And we've also done the manipulation where we have detached the talar neck wire from the tibial ring and attached it to the foot ring. So now we're ready to begin the second phase of the Ponseti sequence, which is the dorsiflexion from Aquinas to neutral. This would be the equivalent, if you're doing a Ponseti treatment of a club foot, of your tenotomy, only now we're doing it with the frame. So how do we do this? First thing we do is look at the last day of the initial program. So the last day of the initial program, we're at these numbers, and I showed you what the frame looked like. But now we want the program to do a residual correction. And so we will push this little TR, which stands for total residual button. And notice that when we do this, we're going to change from Ponseti sequence to Ponseti sequence second correction. In other words, the computer is automatically generating a new program that's representing the second phase of this correction. And so everything stays the same. Total residual, all our notes stay the same, except we add second correction. Computer does that for us. The right ankle, all that stays the same. But what the computer does is it wipes out the deformity parameters because now it asks us to put in new deformity parameters. So I put in this new deformity parameter of 24 degrees plantar flexion. That should take us to about neutral. And so now it's depicting the deformity as a pure equinus. The reference segment stays the same. We'll go to the next panel, the frame parameters. And the computer automatically updated the strut changes that we did, and so these represent the current struts. We didn't have to put that in, the computer put that in because it assumed that we did the strut changes that it demanded from the first program. So now we'll go to the next panel, which is the mounting parameters. The mounting parameters haven't changed. We didn't move this ring at all, and so all the mounting parameters stay the same. So we can go to the next panel, strut settings. Now the computer automatically filled in these numbers for us with the final numbers from the first program. So these are the last day of the initial program, and then when I hit the Calculate Final Settings button, it'll generate new final strut settings that will show us the equinus correction. And I've chosen to show you the lateral view here, so this is before the equinus correction, and this is after the equinus correction. Now you notice that we've corrected it to neutral, but not above neutral. So the next panel asks us to put in the structure at risk. The structure at risk essentially stays the same. It's the Achilles tendon, so it's 45 millimeters posterior to the reference line, posterior to the origin line. And I've scheduled this to go at 2 millimeters a day, and that'll take us 10 days. In reality, I would probably do 1 millimeter a day. It's a little bit gentler on the soft tissues, but I want to show you the final schedule all in one panel. So let's see what that looks like. Here's our final schedule, the seventh and final panel of this series. And we do have a couple strut changes to do. This will take us to a neutral position. So what I'd like to do is go back to the lab and input these numbers, do these two strut changes from longs to mediums and from a short to a medium. And let's see what our frame looks like after we've done this equinus correction. We've just completed the equinus correction, and so now if I look from the side view, let's say we're at a neutral position, you'll notice also that we have some distraction through the subtalar joint and through the ankle joint, because I did program in 8 millimeters of distraction for each of these corrections. If that's a little bit too much, we can back off a little bit, but I think it's better not to compress the cartilage when you're doing these corrections. You'll recall that the last modification I did was to take this tailor neck wire and detach it from the paddle plates that were suspended before, and instead now they're attached with these side plates that are tethered off inside the frame to be out of the way of the struts. And so why did we do that? That's so that the joint forces are focused on the ankle and not on the subtalar joint, because the tailor neck wire makes the talus part of the foot frame attached to the foot instead of attached to the tibia. So we could theoretically stop here, or we could say, you know what, neutral is okay, but there's some memory in the tissues. There's some myofibroblasts that are going to want to go back into equinus. And so it's not a bad idea now, and I highly recommend it, to do a second residual program to bring the foot up into dorsiflexion of about 20 degrees. If you come to 20, it'll rebound to 10 or 15. If you come only to 10 degrees above, it'll rebound to 0. So it's always important to overcorrect a little bit. So we'll run a second residual and see where that brings us. So at this point, we've seen what an initial correction looks like. We did the first correction to do the varus and rotation, the second correction to correct the equinus, but it's not enough to bring the foot to a neutral position. We want to dorsiflex it above neutral. So I'm going to add in a yet another residual. This is the third correction. And how do we do that? Well, let's start at our second correction frame, and that's where we corrected the equinus. And on the last day of equinus, if we press this total residual button, we're going to generate a brand new program that's going to be labeled Ponseti sequence third correction automatically. So I press that button and boom, here we go. After I press the button, I get this Ponseti sequence third correction program generated. It's got all the same data that I had before, don't have to put any new data in. However, the deformity data is different. So I'm going to put in, it initially wipes out all the deformity parameters, and I'm going to put in 20 millimeters of plantar flexion deformity and 3 millimeters of, it's a bit long because we had too much distraction, so I'm going to shorten it a little bit by 3 millimeters. And so that's the new deformity parameters. I do have to put those in. We'll go to the next panel, which is the frame parameters. The computer automatically took into account that we did that strut change, and this is the new struts that the frame has. We can go to the next panel. This is the mounting parameters. Mounting parameters haven't changed. We didn't move that reference ring, so we don't have to put anything in here. We can go to the next panel. This is the strut settings, and the computer automatically filled in the strut settings for us here with the last day of the second program. And when I hit the calculate final settings button here, it will generate the new final strut settings that'll show us what it's going to look like after we get dorsiflexion above neutral. So we have to kind of trick the program a little bit. We told it was in about 20 degrees of equinus, and so it drew this as 20 degrees of equinus. And yet we know that the foot is actually at a neutral, so we do have to fool the program, tell it that it's in 20 degrees of equinus, so it draws it as 20 degrees of equinus, and then it shows you a corrected position to neutral, but in fact, it's going to be above neutral by 20 degrees. Let's go to the next panel, which is the structure at risk. The structure at risk remains the Achilles tendon, so we don't have to change any of these parameters. And I'm going to give it a rate of 2 millimeters a day, so we can finish this in 7 days. Let's hit the next button and see if we have to do any more strut changes. Yes, indeed, there are a few strut changes. The ones in the back have to lengthen, and so we're going to do these strut changes, put in these new numbers. I'm going to take this back to the lab, and let's see what we get when we put the new struts in and the new numbers. Hopefully we'll have a totally completed frame with dorsiflexion above neutral, because we anticipate some bit of rebound that may occur when we take the frame off. Now we're seeing the final correction. We started off with the foot in 20 degrees of equinus. We brought it to a neutral position, and now the second total residual program overcorrected it into 20 degrees of dorsiflexion. We'll leave its fixator in place for about 4 to 6 weeks, and then when we take it off, we'll anticipate some rebound. It won't stay at 22 degrees of dorsiflexion. It'll come back down to 10 or 15, maybe even 5 of dorsiflexion. But it is important to get overcorrection, because you do have memory in the tissues, myofibroblasts, that want to get contractile again, and they're going to defeat you if you don't overcorrect them. So that's our final correction. The foot is now externally rotated. If we look at the bird's eye view, the foot is externally rotated, and we are distracted in the subtalar joint, and we are in dorsiflexion. And that concludes the Ponseti sequence for a hexapod circular fixator.